targets, and these were the targets that were promised by the loan. So it included things like 20% reduction in supply chain CO2 emission intensity and 40% reduction in domestic CO2 absolute emissions. And it identified both near-term levers and long-term levers as well. So these are another way to go about getting finance rather than just asking for like project level finance. A corporate loan or corporate bond is another way to go. And then I think I just want to go back to the last one. This is my last slide. So at GFANZ, what we are trying to do is to come up with a three-phased approach to capital mobilization for industrial decarbonization in Asia Pacific. First is to really try and support the finance industry to understand each sector in the industrial decarbonization a bit more, because there is a knowledge gap between the industry and the finance. And so for the first time, we held a workshop in Thailand between the Thai banks and the Thai cement industry in February. And we asked the banks to bring not only their sustainability team, but also their credit risk officer and their relationship manager to come and sit down with the cement industry to really understand the roadmaps and the technologies and where they are at in Thailand. The second phase is for us to really tackle that marginally bankable and the future bankability issues, as well as, you know, the SME question, by looking at whether the banks could be more proactively engaged with the policy and the market development, so that they can also support and be participating in the development of the policy, the green procurement policies, and also the industrial market uptake on green cement as well. And lastly is the financing solution. But we think that financing solution is just one component of the activities that we could be doing in Asia Pacific to support financial institutions in mobilizing capital towards industrial decarbonization. So I end there. Thank you.
Wonderful. Thank you so much. That was a great overview of many different financing instruments. And thank you, Yuki, for also sharing how and what were the conditions that make some of these financing options possible. Is there any question for Yuki from anyone? We are at time, but if there's anyone interested to ask one question, we can take that. No? I thought people have questions about finance all the time. Great. Well, with that then, also because we're on top of time, I would like to thank everyone for joining us today. Thank you, Yuki, also for being with us today twice and not just once. I appreciate having the same conversation about these very important issues. I'd like to thank our speakers as well today for setting the scene and also for all the work that they do. And we look forward to seeing how we best reflect the emerging themes from this workshop as well in the reports of the Climate Week. So thank you so much for your input and for your engagement in this process. Thank you.
Hello?
Showcasing Premiere in a video, then everyone is silent, when the video ends, and directly starts.
We'll be starting shortly with a short video, so we'll ask everyone to take their seats.
Purposeful action has led us here, to the era of implementation. A decade of purposeful action has led us here, to the era of implementation. We have moved beyond pledges. Hundreds of global initiatives organized to tackle the most urgent climate challenges, now organized behind a single, unified vision for the next 5 years. From protecting our oceans to waste management, from clean energy to climate finance, work is already picking up pace. You are the engine of the global climate action agenda. Global coalitions turning impactful solutions into reality, with clear timelines for investment and progress. We need regional leaders, businesses, communities, and cities to join us. We must mobilize the finance necessary to turn these plans into reality. To help us move faster, topple barriers, and drive action towards COP31, momentum requires everyone. Our plans cannot wait. For our children, our planet, and our shared prosperity. Let's work together. Welcome to the era of implementation.
Welcome everyone to this important implementation lab on extreme climate events and waste impact on health. My name is Dr. Liz Bennett. I'm a public health physician working at the World Health Organization. I'm based at our Asia Pacific Centre for Environment and Health based in Seoul, and our work centres around supporting countries in this region to have climate resilient health systems, healthy urban and island environments, and sustainable food systems that are good for people and planet. It's a pleasure to be here with you today with this fantastic group of speakers and amazing participants as well. This lab comes at a critical time. Climate change is no longer a distant threat. It's a health emergency unfolding in real time. The health impacts are here, they are escalating, and they disproportionately harm those who have contributed least to the crisis, particularly younger generations, vulnerable communities, and small island developing states who are bearing the brunt of these effects. In this region, we feel this acutely. Earlier this year, I was involved in the emergency response to bushfires in my hometown of Melbourne in Australia. where smoke impacted air quality for weeks following. At the same time, we had multiple record-breaking heatwave days, and in other parts of the country, we saw severe flooding and spread of mosquito-borne diseases. Just now, colleagues and communities in the Pacific are dealing with the aftermath of recent cyclone events which have impacted health and waste systems. People are at the centre of the impacts of these extreme climate events. More people are unwell, more people go to hospitals and clinics, putting strain on health systems. Disruption of services makes it harder for families to get the care they need. We are seeing communities displaced, and increasing exposure to plastics and pollution makes it harder, is entering food chains and water sources. The impacts also go beyond the physical. We're seeing mental health being undermined by growing instability and stress. We also see erosion of traditional knowledge systems and ways of life that have long sustained community resilience and well-being. But alongside these challenges, there is real opportunity. Acting on climate change is not only essential for the future of the planet, but also offers immediate opportunities to improve people's health. Making our health systems more resilient to climate change offers an opportunity to build systems that are stronger, more equitable, and better able to deliver health for all. Investment in mitigation and adaptation in other sectors also delivers clear health co-benefits. For example, cleaner energy reduces air pollution, which saves millions of lives from deaths from heart and lung disease. That's why we are launching a Climate and Health Co-Benefits Challenge to showcase these best practice investments that are already saving lives. Transitioning to cleaner circular waste systems and more sustainable supply chains reduces environmental exposures and also cuts emissions. These are not distant gains. They are real, measurable health benefits that can be delivered now. And that's the purpose of today's lab. There are fantastic examples of what is possible across the region and in the world. Now it's time to scale these. Today we will hear about some of these solutions that are already working, but also we'll explore bottlenecks and pathways to connect implementers with the partners and finances needed to act. I look forward to the conversation, and it's a privilege to welcome you here today. To start off, we'll hear from our COP31 high-level climate champion to give opening remarks. Over to you, Samed.
Thank you. Dear friends, it is a pleasure to be here with you today. Thank you for bringing us together for this important discussion. As we move from COP30 to COP31, our focus is very clear: implementation. We have made commitments. Now it is about turning them into the real impact on the ground. In my role as COP31 Climate High-Level Champion, our priority to connect ambition with delivery to make sure that what we agree globally actually people, communities and economies. And if there is one area where this matter most, it is health, because climate change is already affecting people's lives every day. Through extreme heat floods and pollutions, we are seeing direct impacts on health and well-being, and it is vulnerable people who are most exposed. This is why progress we saw at COP30 is so important. To the action agenda, we now have clear pathways forward, including the Belém Health Action Plan and Beat and Heat. These are not just ideas, they are practical roadmaps. They show us how to strengthen health systems, how to improve early warning, and how to better prepare for climate-related risk. But now comes the key question: how do we deliver? How do we take these solutions and make them work in real places for the real people? And this is where we need to talk about waste, because waste is not just environmental issues, it is a public health issues. Flood spread, contamination, health increase pollution, and weak waste system increase exposure to disaster. So if we want a resilient health system, we also need resilient waste systems. This means reducing open dumping and burning and scaling smarter, more circular solutions that protect both people and the environment. But none of this can happen alone. We need stronger collaboration between governments, business, finance, and communities. Because in many cases, the challenge is not lack of solutions, it is a gap between what is possible and what is actually scalable. Closing the gap is what implementation is really about. And this is why this lab is important. It is a space to be practical, to share what works and to focus on what we can scale together, because this is what COP31 is about, not only what we commit to, but what we deliver. I look forward to hearing you insight and continue this work together on the road to Antalya. Thank you.
Thank you so much, Samed, for your opening remarks. And I think that question is so important. How do we deliver? And that's really what we want to answer today in this session. So I think we can all keep coming back to that. Everyone's done very well to make it here. Last session of the day. Well done. We're going to start with a bit of an interactive activity to re-energize us. So we'll be using Mentimeter. So if everyone can get out their phones, we're going to get you to answer a few questions to set the scene for the panel. So you can answer these questions by either scanning the QR code just here with your phone and the camera, or you can also go to the Mentimeter website, and there's a code just down the bottom there if the QR isn't working. So we've got a few questions there for you to answer. The first is, which climate shocks pose the greatest health and waste system threat in your context? The second is, who is most affected by these climate shocks in your context and why? But we'll start off with the first question. We'll give everyone a few minutes to log in. We're seeing heat definitely come up here as a big issue, both heat and heat waves. We're also seeing typhoons, but definitely heat is coming up in many different forms there. We've also got some flooding, rain, also pollution with dust. Fantastic. Thanks so much for answering. I think we can definitely see these shocks are very relevant in this region, and it's great to hear that. Great to hear what is happening in your context as well. Moving on to the next question. Who is most affected by climate shocks in your context, and what factors shape their exposure and capacity to respond? We've got my cat up there. We'll give everyone a few minutes to put their answers in. So we're definitely seeing children come up here, elderly, those vulnerable populations who have contributed least often to these crises. We're also seeing grassroots communities, marginalised communities, and people living in rural areas, farmers and fisher folk, but definitely children. I do love everyone as well. It does impact everyone, particularly from a health perspective. Thanks very much for those responses. I think that provides a really great framing for our panel discussion. So I think now we'd like to go and introduce our amazing panel today. We're grateful to have such an amazing range of speakers to discuss this important topic. Joining us online, we'll have Dr. Agnes de Silva. She's joining us from Brazil. She's the Director of the Department for Environmental Health and Occupational Health Surveillance at the Ministry of Health Brazil, and represents the Belém Health Action Plan to support the health sector's adaptation to climate change. We've also joined by Tiffany Van Ravensway, who's a climate advisor to the Alliance of Small Island States. We've got Dr. Emma Campbell, who's executive director at Médecins Sans Frontières Korea. We've got Michaela Schott, a climate and health implementation and science lead at Bayer AG. And finally, Mr. Iqbal Alexander, who's an expert in waste management and climate change. Please welcome our panel for today. Let's begin with the policy perspective. Dr. Agnes, thanks so much for joining us at a very early time in Brazil. We very much appreciate that. Could you please start by telling us how the Belém Health Action Plan that Brazil spearheaded to launch at COP30 addresses extreme climate events and their effect on public health, including waste?
It's really early morning to me, so I apologize for my voice. It's in the middle of the night here. But thank you for letting me join you online. I wish I could have been there and share all the experiences with you in person. First, thanks for the question, and I think we have some of the answers already in the beginning of this session. And I think everyone knows by now what the Belém Health Action Plan proposes. But I think in principle, what we have to think is that climate change, when we say it changes everything. So that's the reason we need to think in advance, plan, and make a risk assessment before things happen. And the Belém Health Action Plan proposes two cross-cutting principles that help to make sure that the ones that the least have contributed the least to climate change will suffer the most. And that's one of the problems we have. And when talking about waste, what we have is that in most of our countries, we have a legacy that has not yet been solved, and that is good waste management in general. And we know how much this contributes to increase the risks once you have extreme events happening. So like floods, hurricanes, drought, and heat waves, they severely impact waste management. But if you have already start in a situation where these things have not been well addressed, what you have is that you have to deal with a much more complex problem. And in some cases, like we had the experience in Brazil with the floods in Rio Grande do Sul, in the southern part of Brazil. And one of the most important problems we had to deal with was not only during the emergency situation, and I must mention, we had to map to put on the map all the chemical plants and all the waste facilities, and see how much they could have been affected and how much of the chemicals and how much of the waste were already going into the systems and complicating, for instance, the quality of the water that was still being collected and sent for treatment and distribution in parts of the area. So in the end, we estimated roughly 47 million tons of debris in just a few days that were the effect of the impact. So what it can cause, it's a long-term risk for public health, but also it makes it difficult to recovery. So when we think on the situation that you have to deal with the immediate risk, and then you have to think on the waves that come for public health that we have to deal with. One of them that sometimes is forgotten is how to deal with waste generated during the event and the waste that was also affected or the treatment, waste treatment and waste management that was, if it was poorly addressed or if it was insufficient, then it becomes even harder. And then, so we add to that the biological problems and the chemical waste that, as I had mentioned, becomes part of the problems you have to deal in the emergency. In the Belém Health Action Plan, what we propose is that it is addressed, and it is a plan that makes it easier to organize the preparation and response, but not only in terms of the emergency situation as we see in the extreme events. There are three action lines. One is on surveillance and monitoring. The second is on evidence-based policy strategies and capacity building. And the third on innovation, production, and digital health. And I will draw attention to some of the lines where this is specifically addressed. And it is on action line 2 that the objective is exactly to strengthen national and local capacities to accelerate the implementation of the solutions. And it requires multidisciplinary, intersectoral, and participatory approaches, and has to take into account health equity and the concept of climate justice and inclusive governance. Otherwise, we are not going to address the people I've seen mentioned in here. I think everyone think about children and the elders, but what we need to think are also the traditional and local communities, and also the ones living in already situation of vulnerability, living on the streets or having poor housing that are the most affected. And then in this, in promoting in the 2.2 that is from the action line 2, is promoting these multi-sector policies and health co-benefits, and addressing waste management systems and reduction of chemical exposure is part of this prioritizing strategic interventions, and the transformation of the whole system becoming more sustainable, including greening the cities and greening procurements and all the other systems that affect the production of waste. It should be addressed, and there are some lines related to that. And on action line 3 on innovation, production, and digital health, it also mentions that the need to promote research on sustainable manufacturing, packaging, product design, logistics, and ensure equitable production, distribution, and reduce the health sector's carbon footprint. And this means that we have to work very deeply in advancing sustainable supply chains. And this means prioritizing short, cost-effective, and resilient infrastructures, and supporting local and regional industries. But it means that we do need to strengthen climate-informed health surveillance systems and early warning mechanisms to detect and respond to risks in real time. but we need to consider the developing contingency plans and emergency response protocols that are tailored to the different climate. Like I noticed heat is one of the most addressed problems, or is the first everyone think about. But because the heat is related to drought and is related to the extreme weather events related that in a way like we had in Brazil at the same time floods in the south and extreme drought in the north. They are part of the system. So we need to address this in a systematic way, but also thinking on how to respond properly in case the emergency, the public health emergency happens, and all the protocols need to be already in place so we don't waste time in responding. So if we address the universal water, sanitation, and waste management systems, that is an investment that is required by other systems, if we can see how this will benefit health in general, but also will help the health sector responding properly and easily to public health emergencies. So the policies to reduce environmental contamination and even having the location of where the chemicals are may be of a crucial, this type of information is crucial to prevent that the extreme events become an even worse disaster. So this, if we think that all this integrated and cross-sectoral approach is the basics, what is there in place that is proposed in the Belém Health Action Plan. And in fact, when we address this, we are being prepared for what happens in the emergency situation.
Thanks so much, Dr.
Okay. Just to finalize, I would like to invite you to the World Health Assembly, who will be there, that will be talking about the implementation of the Belém Health Action Plan. And it will be on the 18th, May 18th, from 13 to 14, 20, and the Palais of the Nation. And I think if anyone still has not supported or is supporting the Belém Health Action Plan, there is time to do that. So thank you for the opportunity to participate online.
Thank you so much, Dr. Agnes, and thank you for that kind invite as well to the World Health Assembly. We'll definitely share that with colleagues as well. And it's really great to start by grounding us in the policy perspective, and really important to hear about the approach of intersectoral strategies and participatory approaches, so we really appreciate that. We'd now like to hear the perspective of some of the most climate vulnerable contexts globally. Tiffany, from the perspective of small island states, which are on the front lines of climate impacts, how are extreme climate events affecting health systems and essential services like water, sanitation, and waste? And what types of support and partnerships are most needed to strengthen resilience?
Thank you so much, Madam Moderator, also for that introduction. That was really good, and also for the question. And I also wanted to add that I'm also the SITS representative on the Adaptation Committee, so I'll be also giving a little bit from that perspective as well. But from a SITS perspective, climate impacts are not isolated shocks. They are systemic and compounding. For our countries on the front lines of climate change, extreme events are no longer rare. They are a constant and escalating reality. And what we see in practice is that one extreme event can quickly trigger failures across multiple sectors and systems. So extreme weather events such as cyclones, flooding, storm surges, or heat waves, they don't just affect one sector. They simultaneously disrupt health services, water supply, sanitation, and waste management systems. This creates an immediate and interconnected risk, particularly for already stretched and often fragile health systems that we have. When these systems break down together, the risk escalating quickly, especially disease outbreaks, interruptions in essential care, and long-term public health impacts. Hospitals and clinics may be damaged, supply chains for medicines disrupted, and also health workers themselves are affected. At the same time, flooding and storm surges contaminate freshwater sources, sanitation system fail, and waste management breaks down further, compounding the health risk. Health systems in many cities are already highly exposed and not yet fully adapted to these increasing pressures. This is what often happens. An extreme event hits, causing infrastructural damage, leading to failures in water, sanitation, and waste systems, which ultimately results in public health crisis. These are not theoretical risks. This sequence is already happening across many states, reversing hard-won development gains and placing additional strain on limited national budgets and capacities. So these challenges are further intensified by structural constraints unique to SIDS, so small dispersed population, limited fiscal space, and high dependency on imports. Climate shocks also push already constrained systems to their limits. So the key message that climate impacts are deeply cross-sectoral, and addressing them requires integrated responses that connect health, WASH, and infrastructure system, not isolated interventions. So building on this, the question is not whether we understand the risk, but how do we respond to them effectively? As a member of the AC, the priority is moving forward toward an integrated, actionable, and scalable solutions. So the first pillar, first we need to integrate planning. Health systems cannot be strengthened in isolation. They must be aligned with national adaptation plans, as well as water, sanitation, and waste management systems. This requires a breakdown of institutional silos and ensuring coordination across sectors. Without this alignment, we risk fragmented responses to systematic challenges. The second pillar is there is an urgent need to shift from planning to implementation. Many SIDS have strong plans, but lack the sufficient predictability and accessible financing to implement them. We need to scale up accessible grant-based adaptation finance that supports climate-resilient health infrastructure and decentralized services delivery and resilient WASH systems without exacerbating the health burden, the debt burdens that we already have. So in other words, accessible and sustained adaptation finance that provides the support that we need on the ground. And the third is partnerships and capacities are critical. This includes strengthening the early warning systems that are directly linked to health responses, improving health data integration for better decision making, and expanding South-to-South collaboration to share practical solutions and lived experiences. At the same time, investing in community-level resilience is essential as local actors are often first responders in times of crisis. In closing, so finally, there is a need for strengthened international solidarity and equity. SIDS contribute negligibly to the global emissions, yet bear a disproportionate burden of the impacts. And addressing these challenges requires not only technical and financial support, but a genuine commitment to climate justice. Ultimately, the solutions already exist. The challenge is scaling them through better coordination, stronger partnerships, and sustained investments. So we don't lack solutions. We need scale, coordination, and sustained investment. I thank you very much.
Thank you so much, Tiffany, for sharing. I think you really clearly articulated those cascading impacts across different systems and the real need to coordinate across those sectors, so very much appreciate that. We'll now turn to Dr. Emma Campbell. In your experience on the front lines, how do extreme climate events affect humanitarian health responses? And what do climate resilient health responses look like?
Yeah, thanks, Dr. Elizabeth. So for those of you who are not familiar, Médecins Sans Frontières is an international humanitarian medical organization working in over 70 countries. And look, we're working in some of the most climate vulnerable contexts. And we are seeing our medical teams increasingly confronted by the impacts of climate change, changing patterns of disease, food security, displacement and conflict, but also crossing over with the work that we do, for example, in conflict, right? So we're seeing refugee camps where we're working, having arrivals not only as a result of conflict, but at that same camp, groups of people also coming because of the impact of climate change. And so MSF, at the core of our work now, is our response to climate change, and we're approaching this really grounded in our core principles at MSF, which is medical ethics, independence, accountability, impartiality, neutrality, and bearing witness. Based in that, MSF is structuring its work around climate action and under three key pillars. One of those is mitigation, so that we reduce our own operational carbon and waste footprint. Adaptation, strengthening our medical and operational response to climate-related health risks. And when I talk about bearing witness, we're also very active in advocacy, highlighting the disproportionate climate impacts on vulnerable populations. So if I just briefly go through those three pillars, since we're talking about implementation and action, and this might be quite helpful. Mitigation in practice, in one sense, for us might be the reduction of waste and plastics in healthcare, and we've got a bit of a focus on waste in this session. So MSF is working around some complementary strategies, refusing unnecessary or avoidable items by integrating environmental considerations into our procurement, and purchasing or prioritizing sustainable alternatives where medically appropriate. We're reducing consumption by promoting responsible use by our healthcare workers, whilst also abiding closely by infection control guidelines, and where possible, introducing reusable alternatives and working with manufacturers to reduce the footprint of the diagnostics, vaccines, and therapeutics that we're using in the field. And waste management has become a really key part of our work. But I also want to give some other examples of our, under the next pillar, give some examples of our adaptation. And for example, in South Sudan, where MSF has a very large footprint, we have seen severe and widespread flooding, especially during the rainy season. And one example of our adaptation under this second pillar is in Old Fangak. We launched activities to prevent the town from flooding. We installed water gauges, we've trained the community to monitor rising water levels, and worked with other organizations to reinforce the mud levees. And the floods have also significantly heightened the risk of waterborne diseases, such as typhoid and cholera. And so we built a 20-bed field hospital in New Fangak as a precaution in case the Old Fangak hospital flooded. And we saw a huge cholera outbreak in that region, and we were able to use that new hospital for that cholera outbreak, which I think goes to the point that you made, is that responses to climate through health systems are not only about responding to climate, but they're also about more broadly strengthening health systems. And so there is benefit in many different ways, even when we look through a climate lens at these kinds of responses. I have many other examples of our adaptation in the field, but I think we don't have that much time. So let me just briefly go to advocacy, which is our last pillar. And it means, for example, people like myself coming to these events, asking funders, asking those bodies in power to always have a health lens when looking at responses and funding to climate change. One really important story that MSF is sharing is the impact of climate change on antimicrobial resistance, resistance to antibiotics. One of the gravest threats to our healthcare system, to the well-being of humanity. And climate change is having a huge impact and increasing antimicrobial resistance. Warmer temperatures speed up bacterial growth and gene exchange, increasing the emergence of resistant strains. Extreme weather is damaging sanitation systems and spreading resistant microbes. More infectious disease drives antibiotic use, which is also, of course, accelerating resistance, and so on and so forth. And also we are seeing in the context where we work, as I mentioned, extreme climate events. I just want to specifically mention flooding, bear witness to what we're seeing. So in countries where we're working, where we've been working for many, many years on endemic illness created by poverty or conflict, countries like Niger, Nigeria, Myanmar, Somalia, Afghanistan, Benin, Cameroon, DRC, Chad, Kenya, Ethiopia, Mali. Last year, in every single one of those countries, not only were we dealing with the traditional actions that we deal with in MSF, we also dealt with extreme flooding situations as one example of the context that we're facing as a result of climate change. So thanks for inviting MSF to share with you the work that we're doing in this intersection of climate and health. Thanks, Dr.
Thank you so much, Dr. Campbell. I think it's so interesting to hear how climate is shaping not only some of those global health challenges like antimicrobial resistance, but also your own responses in the field as well. So it's fantastic that you're able to join us. Thank you. Shifting now from the humanitarian response to communities and local systems, Iqbal, I'd love to hear from you which groups and communities are most affected by health risks related to extreme climate events, and what do climate resilient community health responses look like, for example, in waste management?
Yeah, thank you so much. Good afternoon, everyone. So from a community perspective, those most affected are typically the groups facing a double burden. First, high exposure to climate shocks, and second, limited access to essential services. So these include children, pregnant women, older person, people living with chronic condition, and also low-income families. So in developing countries, this vulnerability is often even more pronounced as climate shocks tend to hit communities where waste management, clean water, and primary health services are already weak. So in Indonesia, we can clearly see in late November 2025, extreme storm hit 3 provinces on Sumatra Island, where 3.1 million people were affected and nearly 600,000 people displaced. And this was not only a storm and flood crisis, it quickly became sanitation and waste crisis as well. So roads were cut off, communication was disrupted, and villages were buried in mud and debris, and access to clean water became extremely difficult. That creates immediate health risks through polluted water, blockades, drainage, vector breeding, and unsafe condition in shelter. So the most affected communities are often low-income urban settlements and coastal communities in developing countries where drainage, sanitation, and waste management are already weak. And when extreme climate events hit, these systems are often the first to fail, turning a climate shock into a public health emergency. So what does a climate resilient community health response look like? It's not only about emergency medicine after disaster. It's also about prevention, preparedness, and continuity before, during, and after the shock. That means clean drainage, reliable waste collection, safe water storage, and community awareness. Local system that keep basic services functioning even during floods and storm. So in other words, resilience means that community are not only able to respond to a crisis, but also to prevent health risks from escalating when climate extreme occur. So for me, the solution is clear. We need accelerate community-based system that are simple, local, and scalable. In Indonesia, under the National Disaster Management Agency, we developed a concept of disaster resilient village, where resilience starts at community level. And it's built before the disaster strike. That means communities are not only waiting for aid, but they are equipped to adapt, to respond, and to recover quickly. So in the context of climate and health, this should include practical systems such as local waste management, drainage maintenance, safe water storage, and community coordination. So basic services can continue functioning during flood and other extreme events. So partnership is critical in our case. Community resilience work best when civil societies, private sector, local government, schools, all play a role. So my main message is this. The people most at risk are those living where climate vulnerability, poverty, and weak services overlap. And the most effective response is community-led and integrated, linking health, waste management, water, and local governance before the next the next shocks arrive. Thank you.
Thank you so much, Iqbal, and it's amazing to hear examples of these community level approaches that are already working today. So thanks very much for sharing. Finally, we're going to look at the role of innovation and technology in enabling these responses. So I'd like to invite Michaela to answer this next question. Can you please tell us how climate resilient tools in health, technology solutions, and innovation in your work are shaping climate resilient responses?
Sure, happy to do so. And first of all, thank you very much for inviting me here to that panel and for being the representative of the private sector. For those of you who don't know Bayer, the company I'm representing, it's a life sciences company active in the space of crop science, consumer care, and also pharmaceuticals. And maybe starting with that innovative approach, as I see it in my daily work, is actually the team that I'm part of. So having a dedicated team, 100% focusing on the impacts of climate change on health is, I would say, something very innovative in the pharmaceutical industry and something that I'm extremely happy to be part of. So what are we actually doing and who are we? We are a team of medical doctors, of scientists who are looking into how to meet the new medical needs that are arising out of a change in climate, how to meet them today, and also how to be prepared for the future. And very important to mention, we are part of our pharmaceuticals division in the Chief Medical Office, so we are really part of the business. So what does it look like tangibly? We are first of all looking into how to adapt existing solutions and how to develop new solutions to meet this new medical need, and also how can we make sure that the supply chains are actually adapt to a changing climate. Secondly, how do we reduce the carbon footprint of our medicines? And here we're looking really at the entire value chain, so from production to patient care pathways. And then lastly, on how do we equip communities, clinicians, and also the whole system with knowledge to prepare them for managing climate-driven health risks. And our focus, and I was really very intrigued to see that here also popping up, is actually extreme heat, and here more specifically the impact on kidney disease or kidney metabolic disease in a broader sense, and maternal health. And I would like to also emphasize it a little bit more with a specific use case that I brought here today to really showcase on what this can look like in reality. And here I would like to focus on our work on NCD, so neglected non-communicable diseases and climate change in India. And I don't know, many of you are probably aware that heat waves in India are a critical challenge already today on public health, but also on economic stability. There are already national programs and also collaborative efforts in place to mitigate these, but what is really important to scale these up and to support infrastructure and community resilience to be more prepared as heat waves are expected to intensify even more. So what we have done is to translate global leadership into country action. So early this year, the Bayer India team and also our global climate and health team jointly launched our India initiative, complementing our global agenda with country-level implementation. And maybe just to briefly mention, why did we select India as the first country where we'll roll that out? First of all, non-communicable diseases are a major health burden in India, and there's a really high prevalence of cardiovascular, of kidney, of metabolic conditions that are really significantly driving mortality and morbidity. Then secondly, talking about extreme heat, these events are accelerating, and we see nowadays already more than 20 annual heat wave days, and this is also worsening. And then lastly, climate and NCD risks are converging, and particularly through heat-exacerbated chronic kidney disease and also on intensified NCD's vulnerabilities, which is putting additional pressure on an already stretched health system. So this is a really multifaceted challenge to climate and health, and what we have done, we've approached it from a multi-stakeholder approach, and that is paired with our scientific and medical leadership in a global and a local representation, so that we have inclusive bottom-up ownership and country-led action to unlock and sustain implementation pathways here. The program overall is comprised of 3 different pillars, and this is also reinforcing our multi-stakeholder ecosystem approach. The first pillar is around evidence generation. So how do we really build nationally relevant insights on extreme heat, on the prevention of NCDs, on the treatment and also on the management of them, and how do we identify the gaps? Then how do we put that into context? So how do we provide that as a resource to our healthcare professional in a way that is really helpful and that it's also needed? The second pillar is around capacity building. So using the evidence that we have generated to strengthen the primary healthcare workforce and to build capacity for the early diagnosis. You also mentioned prevention. This is a really important element, and how to include that in heat risk management. Also looking into frontline health workers, how do we improve community referral pathways so that those in need are treated faster? Then lastly, this is complemented by the pillar around political advocacy and stakeholder engagement. We are engaging with different ministries, with state governments, with national centers of disease control, and also different other bodies to advocate for these climate and health actions, and also to shape the evidence-informed, inclusive policies as we would like to see them. So for us, our program in India is just a starting point. We saw already a great interest from national level and also on a global level, and we envision that this is an approach that we can replicate in another element, and that we could with that reach even more people and really make a difference in the space of prevention. And with that, I'll leave it here. Back to you. Thank you very much.
So much, Michaela. It's fantastic to hear about the work that's already happening in India and around the world, and really interesting to hear about your team's approach in this space. I'm excited some people have the opportunity to dive deeper into some of Michaela's work that she mentioned as we move to breakout groups now. So I'd like to thank firstly all of our fantastic speakers for their insights, which provide a great basis for our breakout discussions. Together, these breakouts will explore proven solutions and the enabling conditions needed to scale them. So I'd like to invite you all now to move into a breakout group. There's 3 to choose from. So we'll have the first breakout group in this table here, closest to the panel, and that will be facilitated by Michaela. And we'll be looking at innovation, science and technology, particularly exploring health and waste management systems. The second breakout group will be in this second table, and so that will be facilitated by WebCare and explore national policies, regulation and governance. And our third breakout group will be over on the far wall and will be facilitated by Iqbal, and that will explore solutions in local delivery, governance and community-based approaches. So I now invite you to select a breakout group, and we'll be coming back together at the end to share some short takeaways. Thanks very much. So can everyone please move to a breakout group? If you're sitting at the back, can you please move up to the front where our speakers and facilitators are? Thank you. just letting everyone know we'll have about 10 minutes left in breakout groups before we come back for discussion. Just giving everyone a 2-minute warning, and we'll come back together to share our takeaways. Thanks very much to all of our breakout groups. We're now going to hear takeaways from everyone. So I'd like to hear the kind of key insights that came out of your discussions in about 3 or 4 minutes. So we'll start over here with group 1.
So, first of all, a huge thank you to my very active breakout group. We were talking about health, science, technology, and waste systems. And here we had a very diverse representation from a variety of different countries and backgrounds, which helped us to identify a lot of different topics. And let me briefly walk you through the first part, where we were looking into examples on how climate and health surveillance systems, including early warning systems for extreme heat events, better integrate gender disaggregated data to reach the most vulnerable. So I think first of all it was mentioned that there is a need to take a baseline, so to assess what is actually the current status, who is vulnerable, what are the hazards, and also to give you an idea about the data that is necessary to understand first of all what is the right technology to measure what we want to measure, and also how can with that the right data be generated as a follow-up. It was also noted that it is necessary to understand how the information can be transmitted in a way that it's understandable to the communities that are affected. It was pointed out that quite often remote communities have their own language, which might require translation, and work together with them to develop the insights in a way that this is necessary, and also to have the resources available at hand for them, so that not only the information that something's happening is transmitted to them, and then there is no means on how to react, or resources such as availability of medication is at hand. Transitioning to the next question, and I rely on my group to add on if I miss out on anything elementary here. So looking into technology or innovation that are especially focusing on waste and sanitation to deliver results. And here we had a really good exchange about medical waste, about the need to have a more decentralized storage, and the implementation of circular economy approach to waste. Another element that was around the correct waste disposal when it comes to containing anti-malaria residues, which is actually contributing to the proliferation of mosquitoes, which are more resistant in transmitting further diseases. And same is also true for the correct use of antibiotics. Thank you very much. And another element mentioned, and I'll speed up a little bit, around medical waste is have also autoclaves available in remote areas to neutralize hazardous waste, is something that was considered as very important. And then briefly touching upon good practices on decarbonizing health infrastructure. So here we are looking into policies that are very much needed at local level for the sorting of waste, to avoid transportation of waste over long distances, and which that also contributing to the generation of CO2 emissions. Then also focusing on renewable energies, especially when we look also into cold chains, which is particularly important for the deliverable of pharmaceutical products in remote areas, to make sure that the cold chain is not impacted and is a contribution to resilience. And also focusing on nature-based solutions, tapping into the knowledge that is existing with indigenous populations. With that, I hope I captured the discussion. Anything to add? Then good from group one.
Fantastic. Yes, let's give them a round of applause. This cross-cultural dream team covered so much ground. Very well done. I really liked the reflection around language and how important it is to make sure that we're using languages that people respond to in these technologies that we are developing as well. We'll pass to group 3 now. Love to hear your insights.
Yeah, so we had a very productive discussion and also eye-opening experience, listening experience from other colleagues here. The first one is that participants highlighted that climate resilience health outcomes at local level are strongest when waste management, water, sanitation, primary health care, and disaster preparedness are planned as one community system, not as separate sector. It also reinforced that the most impacted group must be engaged, not only as beneficiaries, but also as co-designer and local implementer of resilient solution. Also, the participant noted to give those groups a formal voice, not on a formal role, not only a voice. For example, in Malaysia, they legalized the group as K2K, meaning from us to us. So in practice, it means involving them in village resilience, disaster communities, shelter management, and waste monitoring, because preparedness for public health emergencies start with resilient communities, not only institutions. Dr. Emma, you want to add something? All good? Yes. Good. Thank you so much.
Amazing. Thank you so much. I think it's such an important reflection and really has come out of all of the discussions today, the need for these genuine community participation in these decisions and making sure that communities are at the heart of decision making and therefore action. So thanks very much. We'll pass to our final group, WebCare. Thanks very much.
Yeah, that also came out really strongly in our group. We did discuss quite a few things. We didn't go so structured through the questions, but we did spend a little bit of time discussing the complexity of the issue of health and climate, and we also touched on mental health, which the group felt hadn't come out so strongly previously. And we discussed the need also in this complex intersection of topics of health and climate change to involve a wide range of stakeholders that goes beyond the traditional health actors as well as beyond the traditional climate actors. We heard some positive examples. The group also felt that there was a lack of positive examples here, so we identified some gaps. But we did hear about Australia having taken action at the subnational level when designing their national adaptation plans, where the health angle came in strongly. And then we also heard from Indonesia, where the health ministry is now involved in the development of the NDCs and the NAPs in the coordination mechanism there as well. And then we also heard examples of, which was very interesting, that while Indonesia has now started to involve the health ministry for the policy development at the national level, there are already examples at the community level where the communities are organizing and are responding actively in waste management, for example, and other health issues. So there are functioning responses where the impacts are absorbed but informally at that stage. So there's a question of how this is costed. And then very broadly, we had a lot of topics that we covered, so I hand it back to the group to see if I missed anything. But we also touched on social media, public awareness raising campaigns, especially in the context of mental health and young people. And we went all the way to also discussing gendered aspects when it comes to segregated work sectors. So this is looking at garment workers, or in the case of Australia, where men are overrepresented in working outside. But then also touched on heat and heard, for example, that there are countries where we have beer maps. So there is a, which was very interesting, also linking it back to the need for public awareness raising in that regard.
Thank you so much. Big round of applause. I wanted to close today by thanking all of our amazing speakers for all of your fantastic insights, and thanks to everyone who contributed to the breakout discussions as well. And also a massive thanks to the Global Climate Action team who have made this all happen behind the scenes. So a big round of applause for them. I think what we've heard definitely from our speakers and then also in these breakout discussions is that there is no shortage of solutions. But what we really need now is change to sort of make them happen at scale. And so we need better planning, better governance, smarter financing, and really placing communities at the centre of this decision making as well. I know there's also a clear theme of justice that came out today, and that's clear that the people who have contributed least to this crisis are those who are most affected, and these people need us to move with urgency, with equity, and also coordinated ambition. I think that's really come out of the discussions today, and it's really shown that it's possible. So thanks very much again to everyone for joining, and have a great rest of your week.